So what I'm going to do is I'm going to tell you about common liver diseases, how to recognize it, what the symptoms are, how to prevent liver diseases, and specifically refer to where um, they may be different in women. Um, I would request the organizers to just note down the questions which people might be putting on the
Sure.
chat,
Sure.
and then we I will try and leave 5 or 7 minutes. I'll run through this in about 15 to 20 minutes and leave 5 or 10 minutes for discussion.
Okay. I'll be writing down the list of questions. So post your session or in between, if we have the slot, uh, we'll take it ahead.
Yeah, sure. Okay. So, first I'll start with telling everyone what the liver does. Liver performs like close to 500 functions. Liver is really, in a sense, the core of our existence. Of course, you all know that the brain and heart and all the other organs are important as well. But if you just try and understand what the liver does, there is not a minute we can exist the way we do without the liver. And then I'll tell you a little bit about what sort of diet is good for the liver. And then I'll jump into the diseases and talk a little bit about alcohol and the liver. Something called non-alcoholic fatty liver disease, which many people find that they have fatty liver despite not having alcohol. And then a little bit about viral hepatitis. And these three last things, they form a majority of the reason why the liver goes bad. In about 80 to 90% of the cases, a bad liver or a cirrhotic liver or liver with hepatitis is because of these three reasons. And a bad liver then develops liver cancer. So, cancer in the liver is very different from any other organ. It happens in a liver that is diseased, and the disease is usually because of these three reasons. Now, what are the functions that the liver does? It's basically the main seat of body's immunity and protects us against infections. And minor infections, they affect us, they enter our body all the time. And this is the one that actually protects against the infections actually harming us. So it's the main seat of immunity in the body. Um, then, of course, it regulates blood clotting. So if the liver goes bad, then one tends to bleed more. Now, all the food we eat, all the proteins, carbs, and fats, they're all processed in the liver. So it's really the factory for manufacturing all the proteins that are manufactured in the body, that are circulating in the body, including the hormones. Now, hormones are things that control every body function, right? How much calcium there is in the bone, how much estrogen there is in a lady at different times of her cycle or reproductive period, all controlled by hormones. And that's just two examples. This thyroid hormone, you must have heard of steroid hormones, thyroid hormones. All the hormones are more or less manufactured in the liver. Then the liver secretes bile. Bile has two functions. It helps in the digestion of food, but it also carries some waste products which are eventually excreted out through the intestine. Liver also kind of detoxifies the blood of all the extra drugs, chemicals, alcohol, or even bugs. So it's the basic detox seat for the body. And then liver converts extra glucose to starch or glycogen for storage in the liver. So between clotting, digestion, manufacturing proteins, immunity, manufacturing hormones, it's really the metabolic factory of the body. It is also the detox center for the body, in simple words. Now, what's a liver friendly diet? Interestingly, the Mediterranean diet, if you may have heard of it, is very similar in many ways to what the traditional natural or organic or Ayurvedic Indian diet is. So leave aside the fish and the seafood, but otherwise, fruits, vegetables, garlic, um, potatoes, tomatoes, unrefined cereal, legumes. This is like staple of Indian diet, and that's actually perfect for the liver. And of course, in the Mediterranean countries, as you know, they have a lot of seafood, they have fish, olive oil, and these are also things which are very good for the liver. What's bad for the liver is anything sugary, anything oily, unfortunately, all the tasty things, they are bad for the liver. Now, what does liver disease do to you? If somebody gets liver disease, people ask me, Doc, how do I know if I have a serious liver problem? Well, initially you don't know because the initial symptoms are just fatigue and tiredness, which are very non-specific. There are hundreds and thousands of reasons for that. So in the initial part, you see, because the liver has a lot of reserve, it has at least 50% reserve, which means that unless the liver is 50% damaged or more, you will not feed a thing. And that is why the initial symptoms are very vague. So fatigue, tiredness, low hemoglobin, those are the initial symptoms. When the liver gets more than 50 or 60% damage, then you start getting jaundice, which is yellowness of eyes, excessively yellow urine, and a little pale colored stool. So the yellowness appears only when the liver gets really bad. There is darkening of skin. Almost every patient I see with liver disease says that I used to be, my skin used to be lighter earlier, and now I've become very dark skinned. That happens with liver disease. Patients will have itching. They will have a bleeding tendency. You know, when you brush every morning, you will have extra bleeding from your gums. When you have a minor injury, you will bleed longer. That's what happens in liver disease. And then liver also controls the hormone that determines how much fluid will be there in your body. So if the liver is not working, you will have swollen ankles, feet, even swelling on the face. And in late stages, when the liver disease is really bad, 70% damage has happened, then there may be blood in the vomit, or there may be black stool, which basically means there is blood in the stool. There could be water in the abdomen, where the abdomen actually distends, and that's called ascites. There could be excessive sleep or confusion or aggression, a kind of a pre-coma state, and then coma. So these are the late symptoms and features of liver disease. Now, alcohol, the question that everybody wants answered. How much alcohol is safe for your liver? Now, basically no more than 2 drinks per day for men or 1 per day for women. Anything more than that is not safe. And when I say drinks, I mean units. And what's a unit? A unit is half a glass of beer, about a third of a glass of wine, which is a usual helping for a wine. For a glass of, when you say a glass of wine, you usually mean about 70, 80 mils. 1 small peg of whiskey, which is 25 to 30 mils. And a small glass of sherry. So this is all these equate to 1 unit. And you cannot have more than 14 units a week. And binge drinking is very bad. So if somebody's having 10 units a week, you're probably in the safe limit of alcohol, but they should be spread out evenly over 3 to 5 days. You cannot have periods where you just get 10 units down in one go. Binge drinking will kill your liver. Now, the bad news is that the same amount of liver damage can happen in women with just half to 2/3 the amount of alcohol. And that is why many national guidelines, including WHO and the Ministry of Health, have lower drinking limits for women. Some guidelines say 8 to 10 units, some say 12 units. And for men, it's about 14 units. And that is because, in general, women have low enzyme, something called ADH, or alcohol dehydrogenase. That's the one that detoxifies alcohol. And the amount of ADH in women is less. And that is why less alcohol can affect them. In fact, when they give up alcohol, liver damage can continue even faster than it happens in men. So the fibrosis, which eventually will lead to scarring of the liver and cirrhosis, can carry on even when women give up alcohol. It carries on even when men give up alcohol, but it carries on faster in women. This is just to give you a general idea of what the different beverages equate to in terms of percentage of alcohol in them. I'm not going to run through this, but somebody who takes beer 6 pints of beer a week is maximum they can get in, right? A pint is 540, 560 mils. Or 6 medium glasses of wine a week. That's all they're allowed. Anything more than this is too much. Now, what happens with alcoholic damage? This is the normal liver. This is what a normal liver looks like. And with early damage, with sustained alcoholic consumption, people will get fatty change. And with sustained consumption, they would slowly have a liver that is scarred. We call scarring fibrosis. And a scarred liver, which is a liver which is full of at least 50% of the area is occupied by scars, is called cirrhosis. Cirrhosis can happen from any reason, not just alcohol. It could be from viral hepatitis, could be from non-alcoholic fatty liver. So initially, normal liver becomes fatty liver becomes cirrhotic if there is sustained continuous exposure. But if there is binge drinking, you straight away go on to the hepatitis stage. And that, with repeated attacks of hepatitis, that means repeated binge drinking, can lead to cirrhosis. And that's why I see a lot of cirrhosis in 20 to 30-year-old children or young adults. And that is because they would do weekend binge drinking. They do it. Sorry, there's some people whose mic is still on. Can you mute your mics, please? So what I'm saying is this is something to note. I mean, those of you who are in that age category or who have children or brothers, sisters in that age category, binge drinking on the weekends, 6-8 drinks, can do your liver in within 2-3 years. Because it will cause hepatitis, and repeated attacks of hepatitis lead to cirrhosis. The same thing that happens with sustained drinking over 20 years. Now, let's come to non-alcoholic fatty liver. Why do people get fatty liver even when they don't have alcohol? And that is because of diabetes, which is not controlled, because of bad lipids, because of excessive weight. And if you don't get exercise, if you have too much junk food as a child or even as an adult. And unfortunately, we often blame genes for everything. And this is one of the things that you can actually blame your genes for, because some families have a tendency to having fatty liver. What do you do for non-alcoholic fatty liver? If somebody has a fatty liver and they don't take alcohol, then obviously that needs lifestyle modification. It needs regular exercise, and it needs for you to not have sugar or fatty food. And weight must be kept within 10% of normal. And then, of course, you have to treat the diabetes, the bad lipids, the obesity, which is what caused the fatty liver in the first place. There are some drugs which are available, which are becoming increasingly common. Vitamin E is Evion, everybody knows that, and that's good for fatty liver. We normally prescribe that in doses of 2 capsules a day, 400 milligrams twice a day for 3, 6 months, or even 12 months. And there are 2 other medicines, pioglitazone and obeticholic acid, that have been increasingly used for fatty liver. Now, let's come to viral hepatitis. Viral hepatitis means that there is a virus that infects the liver and causes inflammation of the liver. It could be waterborne or it could be bloodborne. The standard jaundice that we all remember, that somebody we know in the family or ourselves we've had during childhood or early adulthood, is really the waterborne hepatitis A or E, which means that it spreads through dirty or contaminated water and food, and it could be A or E, usually gets better in 2-3 weeks. But there are 2-3% cases that eventually lead to liver failure, but 97-98% cases will recover within 3 weeks and you never get it again. So that's hepatitis A and E. Now the bad ones are B and C. Let's leave D aside. And B and C spread by blood or body fluids, just like AIDS virus. They spread all 3 things. AIDS, B, and C spread in the same way. So how does one get hepatitis B or C? By contacting an infected person's blood, semen, saliva, or other body fluids. So how do you prevent it? Obviously, first you understand the risk factors causing it. And if you avoid the risk factors, that's how you prevent it. Now, sex with an infected person unsafe tattoos or body piercing, basically contact with a needle that has infected blood on it, receiving infected products like when you get blood transfusions from, I mean, this doesn't happen anymore because all the blood banks test quite stringently for BNC now, but it used to happen in the past that one got it from infected blood products or through dialysis machines. IV drug pushers who share needles or in poor facilities where you don't have disposable needles, people can get it through sharing needles. You can even get it through sharing a toothbrush or a razor with an infected person. And the chances of a person getting it if they have someone else in the house who have B or C is more than normal. And of course, it can be passed on from the mother to the baby during birth or via breast milk. So the way to avoid BNC is to avoid all these things. Of course, you can't avoid birth, um, you know, or breast milk. But then, if the baby is vaccinated and if the mother has been vaccinated during her pregnancy or earlier in her childhood, then it should be fine. Now, unlike coronavirus, it does not spread like this. Hepatitis B and C do not spread by coughing, sneezing, hugging, kissing, handshakes, etc. And it is important to know that there is a very effective vaccine available for hepatitis B. It's preventable universally. Everybody should have hepatitis B vaccine right at birth. In fact, within 24 hours of birth, the newborn should be started on the course of hepatitis B vaccination. But if you missed it during childhood, you can have it anytime. At time 0, 1 month, and 6 months, 3 injections. So I'm actually coming to the end of my presentation because I just wanted to give you general concepts and not confuse you with too much hardcore medicine. And I'll be very happy to discuss any questions that you have. But let me say that for a healthy liver, you should avoid excess carbs and fat and try and not have carbs after 6 p.m. Stay within 10% of your ideal body weight. Put in at least put in at least 150 minutes of moderate exercise every week. Now, what's moderate exercise? Mild exercise is when you can sing while exercising. Moderate exercise is when you can talk while exercising. And a very hectic, severe level of exercise is when you can't actually talk. You can barely breathe when you're exercising. So that should give you the measure of intensity of exercise. And you must do 30 to 45 minutes on most days a week. That will come to about 150 minutes of moderate exercise a week. That's absolutely essential for all of us. Then, of course, I said hepatitis B vaccination for family, and alcohol no more than 14 units a week, no more than 8 to 10 units a week for women. Then I told you stuff about how to prevent and treat non-alcoholic fatty liver. So, liver does a lot for you, and you have to do something for your liver for it to remain healthy. And just remember these pearls and some of the other things I've said. So I'm happy to take questions.
So thank you so much. I think that was very informative for everyone who is present on the seminar. So quickly, before we take on the questions, we would just take on one or two questions from the audiences. Before that, because we're discussing about the women's health issues, so if you could just help us understand in a jiffy that when we talk about the liver diseases, what is the ratio that we see in the men versus the women?
So the ratio is more or less the same. That's why I didn't stress on that. Okay. 1 in 3 adults actually have liver disease. So 1/3 of all of us will have some kind of liver disease. It's not serious liver disease. It could be just fatty liver, or or it could be, unfortunately, it could also be one of the hepatitis C or B, because 2% people have hepatitis C and 4% people have hepatitis B. Some of us could be damaging our liver from alcohol. So if you put all of them together, 30 to 35% of us have some kind of early or advanced liver disease. So that's a very high incidence. Now, in the US, they found in studies that women have 5% higher incidence of non-alcoholic fatty liver, right? But in the Indian study, the main study that was done in about 1,000 plus patients across different socioeconomic strata, they found that the women and men had very similar incidences of NAFLD and hepatitis B and C. So there is not much difference in, there's not much gender difference in the prevalence of liver disease. However, I did tell you that women are more susceptible to alcoholic liver damage, right? And they can get damaged, their liver can get damaged with just even half the amount of alcohol compared to men. So women have it very good in most other ways, but not in this one. So that's the thing. Now, the other thing is there are some diseases of the liver that happen during pregnancy. It's called acute fatty liver of pregnancy or cholestasis of pregnancy. Those are, a little complex to understand, so I kind of kept myself off them. But suffice it to say that some pregnant women, about 2 to 5% of them, can get liver disease which is related to pregnancy, including fatty liver, and that generally it settles down with the pregnancy, with the delivery. But very occasionally we see liver failure, which means terminal liver failure happening to about 0.5% of women who get liver disease during pregnancy.
We have also questions which are coming from the audiences. So Madhuri, she wants to know if you could just help her understand what is hepatitis D.
So I avoided that, and let's say that it's not important in India at all. It happens in the Far East, usually accompanies hepatitis B infection on its own. So it's like a kind of it's a virus. Hepatitis D is a virus, and that exists only in the presence of hepatitis B virus, and it doesn't really cause big issues in India. I've hardly come across any patient with hepatitis B in India. But when you think of Taiwan, Korea, Cambodia, they have it a lot. But generally, hepatitis B clears up when the B clears up, either with medicines or with a transplant. So don't worry about D. Other questions, please?
Yes, I'm so sorry. My internet got stuck in between. Yes, I'll move on quickly to the next question. How is corona affecting liver if one gets corona?
So I'll first tell you the science of it. Corona affects ACE2 receptors in the lung. Most people have heard of that. If you read a little bit about corona, that's where it goes and attaches in the body, in the lung. There are some ACE2 receptors in the throat, nose. That's why you get tests done from the nose and throat, and you would find corona. Fortunately, even the liver has ACE2 receptors. But fortunately, liver's detox mechanisms are very strong. So corona can get into the liver, but it doesn't cause much liver damage. So in most cases of corona, you will have either no effect on liver tests or mild elevation of liver enzymes, which is SGOT, SGPT. And that is inconsequential. But now here's the thing. If somebody has pre-existing liver disease, especially chronic liver disease, it's been found in studies of which I've been a part, and actually I've published this, that people's liver disease, if before they contracted the COVID infection, will get worse with COVID infection in about 40% of the cases. And people who have hepatitis B or C, where the liver is 50% damaged, they may proceed to 70, 75% damage. People who already have 75% damage and waiting for a liver transplant, they may actually, unfortunately, succumb to COVID infection before they can have a liver transplant. So it makes pre-existing liver disease worse, but hardly causes serious or significant liver damage on its own.
Okay, so I'll be reading the next question, and this will be the last question amongst the audiences. So she says, I have hepatitis B, but none of the reasons valid true in my case. I have never been in a sexual intercourse. My mother does have it. No alcohol, no unsaved two or drugs. Any of the reasons that you shared, could you please explain that? Also, is hepatitis B reversible?
So, did she say her mother has it?
Mother doesn't have it.
Does not have it.
Yes,
Okay.
you just corrected.
So now the thing is that the commonest way that a person who doesn't know how they got it, has got it through an infected needle or syringe sometime in their life. As a younger person, having a vaccination in a local clinic or something. That's the usual way that they've got it. Also, if they've got a blood transfusion several years earlier, that could be another way of getting it, because in the last 20 odd years, 15 years, the blood banks have been very stringently controlled. But before that, you used to get hepatitis B and C from blood products. So those are the two that I would blame.
Okay, so she just added on one more thing. Is this condition reversible?
Hepatitis B is treatable. Okay, now if the hepatitis B is, if the person only just has hepatitis B surface antigen positive, with an ultrasound and liver test not showing any other liver damage, they don't have to worry if their DNA count that is negative, which means the viral, the viral replication is not happening, or the virus is not multiplying in the body. So what one should do is, one should do a complete hepatitis B panel, which means hepatitis surface antigen, hepatitis core antibody, and hepatitis B DNA and E antigen. And then a liver expert like myself can make sense of it for them. Generally speaking, if they are DNA negative, the virus is not multiplying, and if the liver does not have damage on ultrasound or CT scan, then they are good. Then there is nothing to worry about hepatitis B. A small percentage of these patients will have chronic hepatitis and progress, but 80 to 90% of them will not progress further.
So thank you so much. I think we've taken the questions from the audiences. We'll take them, in the next session if anyone is left. Since we had limited time with Dr. Soin, to end this session with you, sir, quickly, now the entire world is facing the pandemic and we're going through a tough time. So quickly, two things that you'd like to highlight and bring it under everyone's eye, that we being the women, we can take care of ourselves, because generally we neglect our health a lot when we talk about the entire women community, if I be the face or the voice of the entire community.
So liver health or COVID? Or both? COVID.
Yes.
Right. Okay. So I think honestly nothing particularly specific to women, but all of us need to understand that there are 2-3 things. One is that COVID is here to stay. It'll probably be around for a few years, and you probably get a seasonal vaccine available in a year's time, which, like H1N1, like flu vaccine, can be put in with 70-80% efficacy. And other than that, we have to continue to observe social precautions and personal hygiene. That means masking, hand washing. And so that's the new normal. The other thing I would say is that if somebody has COVID, the last thing to do is sit at home and hide it. You must see a doctor for 2 reasons. One is you're actually harming your, friends and family and society. But the more important reason for yourself is that people can actually be like that, they're stable with COVID infection and suddenly they get worse and in 2 days they're in ICU. So you have to be with a doctor, you have to be under medical supervision if somebody has COVID, don't hide it.
Right. And because you're a liver specialist, when we just talk about taking care of the liver in such times, one thing that all of us, we need to keep in mind, apart from the things that you've already discussed, because you've discussed already.
Yeah. I mean, I would just re-stress that just because there's COVID doesn't mean that other diseases are going away. So all the precautions I said about liver still have to be taken. You still have to have a healthy lifestyle, with exercise and the right kind of food. And if somebody has diabetes, obesity, and bad lipids, they should see a doctor. Don't keep sitting in thinking that there's COVID times, I must keep myself protected at home, because you could be having liver disease that gives you 10, 20, 50% life risk. what's the point of sitting at home, because you might have 2 to 3% risk for getting COVID. So COVID is not the big risk, because COVID is generally an infection that would get okay in most patients, even though there is such a lot of hype in the world. But if you have significant liver disease, you must see your liver specialist. Don't sit at home thinking I'll do it after the COVID is over, because we don't know when that's going to happen.
Right. So thank you so much. I think it's time for us to say goodbye, and a big thank you for taking the time out and joining us here. I think your session all in all was very informative, very interactive, and thank you so much for taking the questions so well. I think the person who asked the question has got the answer quite well. With that, thank you so much once again. I would request everyone to please give Dr. Soin a big hand for being here with us and making it so much special.
Yeah, thanks very much for inviting me. It was a pleasure being with all of you. Bye and take care.
Thank you so much.